I'm very pleased today to welcome Dr. Joyce Martin from the Biomed Center, New England, who's joining us to talk about IV therapy. Welcome, Joyce, and thanks for giving us your time. And without any further ado, I'm going to share my screen and turn it over to you.
Thank you. Welcome, everyone else also.
All right. Joyce, can you see that clearly?
I can.
Awesome. Just let me know as you wish me to advance.
Sure. Hello, everyone. So I am Dr. Joyce Martin. As Katie gave me a lovely introduction, I am an advanced practice registered nurse here at Biomed. My background is a little diverse. I'm also a chiropractic physician, and I'm overseeing the bioenergetic department here as well. But today we're going to be discussing IV nutrition and hydration. And you can advance that slide, please. And as far as the introduction goes, you can advance that next slide, please. So what a year we've all had, right? Talk about stress. So here at Biomed, we see all different types of patients. We see people that come for wellness, and we also see people that are athletes and want to improve upon their health and keep it either status quo or make their health a lot better. We also see very sick people. And I am going to reject that call. I'm sorry about that. Our IVs, and in slides to come, we'll show you the actual IVs that we do here. We have different combinations of vitamins and minerals, and we don't claim to cure, treat, or mitigate anything, but people do come with symptoms, and we look for the root causes, and then we will formulate with the colleagues here, as we did, a menu of specific IVs. So here you can see some of the things that are the IVs that we have here do help. It will work at the cellular level. It improves digestion, metabolism. It can enhance mood, help with fatigue, and strengthen bones. We have mini infusions that take 30 minutes, and it can go up to over an hour. As far as ozone therapy, ozone is actually O3, which is oxygen. And we do that with a UVBI light or without it and just straight ozone. And that has been helping viruses, infections, skin issues, protozoa, and quite frankly, they've been using it since the 1800s for infection and whatnot. So IV therapy has been around a long, long time. From the 1800s, it actually got really moving at a quicker pace around 1950s. Also, you know, with the year that we've had people working from home, stay-at-home moms, retirees, it really doesn't discriminate who it's really great for. Next slide, please. So we're delivering vitamins, minerals, and other nutrients, amino acids, into the body through an IV bag. It's a small, tiny needle that advances a catheter. It's temporarily placed, and the nutrients are administered very slowly and safely. Like I said, in the previous slide, I was talking 30 to 90 minutes. Why this is the best delivery, it's called a first pass effect. What that means is any vitamins, minerals, medications that anybody puts into the body can stop at a certain point. And usually that's GI related. So for instance, vitamin C, if you take 2,500 milligrams of vitamin C, it may not get there appropriately or as quickly as an IV. So we could give, 12 times the oral vitamin C, and in just one IV, you have that 12 times the normal amount. So it's very safe. And like I said, IV is definitely the way to go. We customize based on everyone's health goals. And the benefits are the detoxification, inflammation, which is the root cause of so many illnesses, Pain relief is improved mental clarity, brain fog, immune system, and skin. Next slide, please. So, adverse events and side effects, we are very safe here. Prior to any IV, as in any practice of efficient and what we're practicing here is biological medicine, but this is a medical procedure. So all labs, allergies, past medical history, review of systems, the patients are examined prior, vital signs, pre and post, sometimes during, and throughout that infusion, a nurse is with them. Every 15 minutes, they are assessed for signs and symptoms. Upon discharge, there are instructions given. Next slide, please. So pre and post instructions. So hydration. Hydration, though we're giving fluid, we need the patient to be hydrated. So my rule of thumb is for them before bedtime to drink a liter of water, preferably pure bottled water. And then during their treatment, we like them to hydrate. Also, eating is very important. So if they're coming in the morning, go to breakfast, coming at lunch, good lunch. They can bring food here. We have snacks for them here. And also when they leave, we do want them to hydrate, again, with a liter of liquid right after. Comfortable clothing is always a great idea. The IV is usually in the antecubital space, which is on the opposite side of your elbow, usually. So a short sleeve shirt, bringing a sweater is a good idea. We also have blankets here and pretty much everything to make people comfortable. We have a TV in the room, and we encourage them to bring a book, a magazine, music, whatever they would like to listen to or do during their relaxing time. Next slide, please. So, glutathione. This is probably my favorite antioxidant. Glutathione is so powerful in so many ways. It detoxifies the liver, actually the whole body. It assists in DNA and protein synthesis, amino acid transports, enzyme activation, and it is probably the most powerful product that is in our body for the immune system. It's the most abundant, and it's critical to have, and it's great for immune function, like I said, and also regulates oxidative stress. Clinically, we see it has been used for a wide range of symptoms and diseases. But like I said, we're not here to talk about one specific disease. And I would like to mention that here at Biomed, we also co-treat with patients, physicians. Next slide, please. So Myers, the BioClassic is how we've named it here. This was from Dr. Meyer, and he formulated this type of IV. In the old days, as an RN, we'd call it the banana bag because it's yellow in color due to the vitamins that are in it. And it can help manage, and that's the thing that we're doing, you know, the biggest is we're managing and co-treating patients with all types of discomforts and ailments. It's especially helpful with people with digestive issues, and we're seeing a lot of patients with digestive issues. Next slide, please. So again, this is the BioClassic. Now we're going to go through the list of the IVs that we're offering here. And it's a great way to have your increased energy level. Nowadays, people are just working so hard. They have families, everything that we've gone through for the past year. This is definitely one of our top ones that we're infusing on a regular basis. The BioImmune is high dose vitamin C, and that's at different dosages. So it's recommended for immune support and those that are suffering from cancer, though they may be getting their cancer treatments elsewhere with their oncologist, we co-treat and we support them at this difficult time. There are studies that show that the high dose vitamin C infusion assists chemotherapy, especially in ovarian cancer. And you can see what it contains here. We start at 7.5. Next slide, please. BioQuench. BioQuench is great for energy and hydration. This is lactated ringers, which has potassium in it, among other things. So, and we'll talk a little bit about our screening and our lab tests maybe a little bit later prior to coming and having an IV, but lactated ringers has potassium. So just the other day we had a patient, his potassium was high, he wanted BioQuench and he wasn't a candidate for that. So here safety is number one. I can't say that enough, and that's how we practice here. BioPower is incredible for athletes. It's a mix of amino acids, minerals, vitamins, and it assists the athlete or the patient in reaching their health goals without recovery setbacks, which is pretty important. BioBrain. This is wonderful to fight off brain fog, and it gives us a great mental clarity and more of a focus. Next slide, please. BioSinus. So many people don't know that they actually have sinus issues. This is an important piece because I suffered for many, many years and really didn't know that I had clear-cut sinus issues because nothing was, there was no rhinitis or anything like that coming out of my nose, but I would get headaches. And BioSinus is incredible for allergies, postnatal drip, sinus complications, whether people have had post-surgery for sinusitis or any type of nose surgeries. It's also good for patients like that. It contains glutathione and acetylcysteine, and there's much evidence out in the field that shows that that works as a mucolytic. So it increases the absorption of the glutathione and it cuts down on mucus formation. BioGlow. This is for your skin, and the infusion contains biotin, which is awesome for hair, skin, nails, and that goes along with zinc and B vitamins. And you can see what it contains right there. Next slide, please. BioSoothe. That assists in migraines and headache relief, and it helps people with restless leg syndrome, muscle twitching, and spasms. And then BioDetox, that's also a very, very popular one here. This is followed with a glutathione, which is a very, very important antioxidant. And it's a good addition to any detox program that we're doing here or anywhere else. And, prior to going on a trip or, around the holidays, this is an awesome, awesome IV. Next slide, please. So, benefits of IV therapy. Enormous health benefits. Energy, immune support, preventing viruses, protozoa, infection. Some medications and diseases interrupt our abilities to take on our nutrients that we need and also to fight off what we don't want to have. So the delivery is directly into the bloodstream. We infuse very slowly and safely, and the body is able to utilize that immediately rather than, hoping that if you take a supplement, a pill, or a tablet, that it's going to get absorbed, because I talked a little bit and touched on the gastrointestinal tract can't absorb many vitamins that we are trying to get into ourselves. One of the most important things is the chronic conditions, and it's unbelievable really what it does. And many symptoms, it helps, and as you can see here, they're all listed. And there's even more than that. Next slide, please. BioOzone. So this is O3 that we actually take out of a tank, and we take blood out of the patient, and we mix the ozone in the blood and we put it back into the patient. It is unique, and it signals molecules in your body for anti-inflammation, antiviral, antibacterial, and improves brain function, increases energy at a cellular level, and it improves as I said, the immune system and decreases inflammation. Next slide. So with ozone, we can give it just ozone, like I had explained, or we have a UVBI light that's very, very powerful. The blood actually in the tubing can pass through the light, and it increases the benefits antimicrobial and antiviral to the cells. The bio-UVBI is ultra blood irradiation therapy, which is what I just explained, and we can do that without ozone. So, and you can see all the effects of the immune system, anti-inflammatory, the circulation, cardiovascular protection, and anti-infection capabilities. Next slide, please. Benefits of ozone therapy. Wow, there are so many. I touched upon the anti-inflammatory, how it works very, very well by affecting our biochemistry to get our body to actually heal. And what we do here, especially at Biomed, is we want to look at the root causes of your symptoms and your illnesses, and we work on that biological terrain at that level. It modulates and stimulates the immune system, as I said, and it's very effective in fighting disease. Increases oxygenation to your tissues. It attaches to the red blood cells, and it makes them more elastic and flexible. It's profound on cellular respiration and wound healing. And it increases energy production within the cells. Low levels means that your low levels of this oxygen means that you won't be healthy. Increased antioxidant enzyme system is always important, and it does a great job at that. And it reduces the acidity in your body. Next slide, please. So I'd like to acknowledge Anthony, our nurse here. He was very helpful in putting this presentation together. And I'm ready for questions.
All right, I'm just going to stop sharing. Very good, Joyce. Thank you so much for that presentation. I know it's a lot of information and a lot of options, surely, for anyone interested in IV therapy. I'm going to start with a series of questions that were sent in by participants, and then if anyone else wishes to ask a question and have it answered here, please feel welcome to just put it in the chat box, and I will check those off or read those off as we go. All right. So the first question, actually, it's a series, as I said, but we'll start with the very first, which is, how safe is ozone for treatment?
It's very safe. It's been utilized for more than a century, as I had mentioned, and its effects are proven, consistent, and they're safe. And there's minimal and very preventable side effects. As with any needle or IV, we're always careful not to infiltrate, not to have air in any of the tubing. And our nurses are very seasoned here, so it's extremely safe, and extremely safe.
Another part of this series of questions is to ask if there is a die-off reaction as it's, killing these microbes in the body.
That's a great question. I have not heard about that or seen that. So honestly, I'd have to do some research on that, and I'm not exactly sure.
Sure. Another related question, have patients ever spoken to whether they feel like they have more oxygen after they've received ozone therapy?
Actually, they don't feel really different, other than sometimes a little bit of fatigue, but it goes away.
Okay. And are there other ways to receive ozone into the body?
Oh, yes, there are. We do it. We can do ear ozone, nasal, rectal, and vaginally.
Okay. And is there anyone for whom ozone treatment would not be safe or recommended?
Well, we are very strict in our laboratory assessment. Mm-hmm. So if G6PD, for instance, was off in numbers, we wouldn't do that. The blood thinning labs that we do, INR, PTT, PT, If those are not on point, we would not do it. But other than that, it's safe for everyone.
Great. All right, so some just follow-up questions, because you're talking a bit about the process, and I know you mentioned it in your presentation also. Can we talk a little bit about the screening process you just mentioned? What would you recommend as a course of action? For instance, should patients schedule multiple appointments, one in which to have some blood work done, or can it be done the same day?
Right. So what happens here at Biomed, they make an appointment. Usually Anthony's doing those consults. We have other nurses on board also, and he'll do the IV nutrition consult. And then him and I will get together, we'll review it. And when the patient agrees that it's something they'd like to do, we do the series of blood tests, which I order. The nurses do the phlebotomy here, and they're sent out. And there is a lab that we work with here in Rhode Island that I had preliminarily spoken to see if we wanted to do an IV same day, would that be possible? Because we have to have the lab values. No one gets an IV unless I review those lab values, as well as the other providers here and the nurses. So we're very strict on that. We did find a lab that would, if we got it to them early in the morning, by noontime, they promised they would have the values. We haven't done that yet, but it's something that I'm trying to work on.
All right, so for the time being, should a patient come to you, they'd likely have to anticipate it would be across multiple days that they would have the screening done, and then.
Yeah, we could get stat blood work within 2 or 3 days usually.
Okay.
But we are working on, if people wanted to come, just spare the moment in and they want it that day. It's a little tricky, but we think we could get it done.
Okay. And in terms of that screening, I know you mentioned one term, I think G6PD, is that right?
Yes.
And are there other risk factors that would encourage, or I suppose signal to you that perhaps a patient is not a good candidate for IV infusion? Actually,
there are. So if they have anxiety, about getting an infusion, sarcoidosis, it's very rare. It's prevalent in women, and they would not be a candidate. Arrhythmia, heart block, anybody with severe burns. There is a muscle condition called ptomaine disease. They would not be a candidate. And there are specific paralyses, neurological paralysis, that would not be a candidate.
Okay.
If there's, and then when we look at the labs, if there's, increased calcium, they might not be a candidate. But pretty much, that's it. And any specific allergies to anything in it. For instance, if someone's, any one product that they have on an allergy list, we get, we're very thorough. We have a long form that people fill out that I require, and all the providers do here. They have medication lists, allergies. We look at it all. We look at past medical records, review of systems, and our examination. So we're pretty thorough.
Awesome. Jack, I just want to acknowledge, I see your question. I'm going to come back to it in a minute, but I did have a question from Dana, who asked, if you have a series of IV therapies within a short window of time, maybe this is kind of two questions, do you have labs, drawn every time you have treatment or have an infusion?
It depends on the patient, but here at Biomed, it's every 6 to 12 weeks, depending on what's going on.
Okay, and then I want to kind of dig down on this question a little bit. Is there a recommended length of time between IV infusions?
We do them maximum twice a week here, but they could have them done 3 times a week. Very rare instances are they done back to back, but yeah. So it's a very rare occasion.
Okay.
They would have it 4 days in a row.
All right. One of the questions that was asked, Jack asked a question about facilities in Ohio. I think he said Northeast. I'm just looking. Yep, Northeast Ohio. Joyce, I don't expect you to have the answer to that. Liz just posted a link to our Biomed Network locator, and you can use that tool to try to find, if you're within the US, you can use the map feature to try and find practitioners near you. If you're international, we list some bioregulatory or biological medicine practitioners all the way at the bottom of the screen. But kind of going to the point of how do I find a safe facility for IV treatment? What are the factors, some of the factors, Joyce, that people should consider when they're seeking out a safe option for IV infusion?
Well, I always kid people around and say, you can always ask Dr. Google, but balancing safety and convenience is very important. When I'm looking for someone, I look for board certifications, expertise, experience, the setting. Will they communicate with my other physicians? And, just the cost. And I always look at reviews.
Mm-hmm. When you look at reviews, what do you personally look for?
I look at actually what the patients or the consumer is actually saying about the facility.
Mm-hmm. Very good. I have a similar question in terms of kind of the total patient experience. Lisa asked, do you coordinate care with other specialists, for instance, a hematologist or gastroenterologist?
Yes, and also oncologists, other bioregulatory and functional medicine doctors. We work with them all the time.
Yeah, and speaking about an oncologist, I know you mentioned in your presentation that high dose vitamin C is one kind of co-treatment that can help people who are treating cancer support their immune system. But what are other IV options for individuals with cancer that might support their health through that process?
Ozone.
Ozone. Okay.
Yes.
And I know you had several options for ozone. Is there one of those you generally recommend over another?
The duo with the UVB light is important, I feel.
And can you just say a little bit more about why you'd recommend that one? And once again, just highlight the power of the UVB light.
Yes. Oh, of course. And I won't get too much on a tangent, but light is very healing. And we have specific light that is healing, such as that. We also have the violet light from the sun that is very healing. And we also have blue light that is very harmful that unfortunately we're all sitting in right now. So what I have on right now are blue light blockers. And if you research blue light and all the different lights, there are healing lights and there are lights that are harming all of us. So adding that light will definitely increase the immune system and it enhances the effect of ozone.
Okay, very good. All right, other questions. Someone asked, is it acceptable to ask for certain treatments, like for instance, you have the whole list, or is it better perhaps for a patient to be guided by their practitioner when determining what goes into the drip?
Well, certainly anyone can ask for what they desire, and it's best really for the provider to correlate their needs and wants with their past medical history, review of systems, diagnostic tests, medications, supplements, and perhaps coordinating with their doctors that are referring them here or that they're treating. But we do take everything into consideration. Everyone is wonderful and kind here at Biomed, as they always should be when they're treating patients, but we do treat this like a medical procedure. So if the nurses and providers here are the experts, in a very kind way, we guide the patient to what they really need.
Mm-hmm. And yeah, I know we talked a little bit about like pre-screening for certain conditions, but thinking about the patient's needs at any given time, are there certain, thinking about the day-to-day, if you're feeling like maybe you have a uptick in hay fever, or you feel like maybe you're fighting something off, would you discourage someone from seeking an IV infusion at that point, maybe rescheduling, or would it be acceptable to continue forward if all the other pre-screening has come up okay?
Well, if it was, an allergy type symptom and their vital signs were fine and they were up for the IV nutrition treatment that day, or, the ozone, and their labs within the time frame of 6 to 12 weeks and everything looked normal, I would recommend that they actually have their treatment, especially if that could help them and support what they're feeling and going through.
Okay, good. Similarly, thinking about kind of the after experience, are people who receive IV infusions, kind of good to go about their business during the day? Are there any side effects that are typical? I know you talked about the importance of, kind of the pre and post hydration, sleep, etc. But just even all those things taken into consideration, what's the after experience like? Any side effects?
I have not seen any. People just go around, about their normal day.
Okay. if they were underhydrated or perhaps undernourished or were not getting adequate sleep, would you expect to see some side effects at that point?
Well, we'll usually see that ahead of time
Mhm.
because if they're not hydrated properly, those are the patients that we probably can't even get the IV into. So we're very cautious. And there are people that don't get their IV on a certain day because their body can't support that at that time.
Understood. Okay. And thinking about the list of therapies that you provided, how frequently would you recommend someone perhaps consider starting off to receive an infusion in order to get the benefits that you described?
Most of the IVs here, we do once a week.
Mhm.
Certainly they could have them twice a week and for 6 weeks with a reevaluation.
Okay, very good. I just want to, again, invite anyone else in to ask their questions. I know that we've put a lot in front of Dr. Joyce, but we certainly have time.
Joyce, can you just elaborate on that a little bit more? So are you saying that about 12 IV, getting IV, that 12 is like the magic number, or 10 is the magic number of when you actually start to see benefits from this process?
Actually, I've seen benefits within one treatment, but how I treat usually is it's usually one IV a week and we reevaluate at 6 weeks. Sometimes it's 2 IVs a week and we'll evaluate maybe at 3 weeks. So that's, but we're here. I mean, I look through a window, I can see the patients, I go in the IV room, I sit with the patients, the nurses are constantly in there. So there's a constant review. There's a note done, we call it a SOAP note, subjective, objective, their assessment in their plan. It's every day, it's done by the nurses at least, and most often done by me. So we're constantly in there seeing and checking on the patients. But on average, with the type of support we're giving, it's usually 1 to 2 times a week.
And are there, at the Biomed Center, are there plans for like discounts, or if you get, if you buy like 10 pass or things like that, do you group discounts?
That's a great question. And a lot of patients will ask me about the money end of things. And I'm so sorry, but I don't have those answers. I'd have to ask the admin or the front desk. Sometimes, Biomed's running a business. We want to help people. We take into consideration scholarships and things like that. So if there's a special request, it's always considered here. But I honestly don't deal much with the financial piece.
Very good. Are there, Chris asked a question, are there any benefits for COVID patients? I'll start with that. Yet there are 2 questions. So any benefits for COVID patients or people who have experienced COVID?
Funny you should ask that, because I worked on COVID response and on vaccine trials and different things. And there's not enough research really to give you a definitive answer, but in the presentation and in my slides, there are so many things that are helping the immune system, particularly some viruses, some microbes, some protozoa. So I think that it's a personal decision at this point, because the research, this just happened last year, about a year and a half ago. We really don't have definitive research studies that are complete at this point. Personally, I get IVs. I think it's the most amazing thing in the world, but I've been doing this for 20 years. So on a personal level, I mean, I think it's the best, latest, and greatest. Be a product of your product, right? But I've been all about health my whole life, since my teens, really. So I highly recommend people coming in to talk to us, but it's more of, and we do more customizable type things here too, and we look at so much, it's kind of hard to really give a direct, definitive answer on that.
Well, so we've all seen the numbers, right? And the Delta variant is something that is causing anxiety, and the numbers aren't necessarily heading the direction we want them. So immune health is certainly something I think many of us will be thinking about, especially as we head into the changing seasons. Is this something that you might recommend? I mean, would you recommend IV therapy be considered as kind of part of a regimen to support the immune system, given especially the context we're in?
Absolutely. Absolutely. I have told so many people about biomed, and I've been talking nutrition for, over 30 years, and holistic health, and bridging the gap between allopathic and homeopathic and natural medicine. So honestly, people are really flocking to places such as biomed at this point in time.
And I want to talk a little bit about too, Joyce, you mentioned that IV therapy is particularly effective because it goes directly into the bloodstream, right? And you you mentioned the number of patients you have who have maybe absorption issues, poor gut, these sorts of things. Can you just kind of speak a little bit more? Because I think when we think about poor gut, right, maybe we're thinking about a diet, a fast food diet or something like this, but I know that it's a much deeper, more meaningful kind of subject than that. And I think the diet can be compromised in so many ways. Could you maybe just talk a little bit about that and, kind of what you see on your end in terms of how an affected gut will then affect nutrient absorption?
Of course. So there's that first pass that I spoke about a little bit about, but I give people and patients the analogy of this. When my children were born and the baby's born, breast milk is always the best. Secondly, we have to give formula if the breast doesn't work out. But they tell you not to feed the baby anything solid, any food, any cereals for 6 months. It used to be 3 months and now it's 6. And there's a reason for that. The baby doesn't have their enzymes developed. You develop that over time. You also lose that over time. So hormones, enzymes, unfortunately, this is how aging, this is the process. So sometimes I see younger people or in their 20s where the enzymes are needed to be supplemented. But not everybody is into nutrition and health. So I can't tell you the amount of people that come and, they're constipated or they're having diarrhea or whatever that is. So the integrity of the actual gut is not functioning to an optimal level. So therefore, anything we're taking in isn't going to be absorbed. Years ago, allopathic doctors, some of them would say, expensive urine, it's just going to come out. And they've actually done studies where they've seen capsules and tablets that have been found in the stool. So IV is a sure thing. It's going in, and there's many studies that I actually have and I could share, especially with vitamin C. I mean, you can give someone 2,500 milligrams of vitamin C, and it's probably, an 80th of the absorption that we can get with an IV. And it's just so important, so important for so much. And then, just to mention, like magnesium is something we put in some of the IVs, and that will really get the gut moving. But honestly, it really, really isn't enough. After even healthy individuals, even people not eating processed foods, you should be moving, that GI system should be moving, and people should be having 3 bowel movements a day. And I can survey it through the years of practicing nutrition. People just, you're lucky if they're going once a day. Mm-hmm. So it just can't get absorbed.
Well, and I think you said something which I had heard as well, which is even if you have a very healthy gut, the rate of absorption compared to an IV infusion is still quite significant.
Right, and we can check that in the plasma levels. The research is out there on that.
Yeah, okay. I did have another question asking if there are any treatments specific to psoriasis plaques.
So it's funny. I learned through the years that psoriasis, eczema, fibromyalgia, and I could go on and on and on. We could be here all day talking about different things. A lot of those are gut related. So what we do here in bioregulatory medicine, functional medicine, what we want to do is identify the root cause of the condition. And when we do that and we make changes is when the symptoms go away.
Mhm.
I hope I answered that question.
Yes, kind of. Yes, I hear you loud and clear on the gut and making some substantive changes. But speaking very directly to IV infusions, is there any that you'd recommend for that condition?
The detox.
The detox. Okay.
Yes.
All right. Very good. All right. So let's talk about if someone is participating in this talk and is eager to, get connected with you and your colleagues at the Biomed Center, what is the, something they should do or the first thing they should do in order to make their way to you?
Okay. Well, first of all, calling, the number is 401-443-4007. Our admin at the front desk, they're all amazing. And you tell that you're interested in seeing one of the providers. Or you could go the route of meeting with one of our nurses first, who could do an IV consultation, but then they would see me also. So there's two ways you can do that. If you just want to come for the IVs, which honestly, it's not going to get to the root cause of your problem and be customizable, but people do that, and we do offer that. In Dr. Drobot's lecture with the BioBites, you could hear about the diagnostic tests that we do. And, my late parents taught me there's a right way and a wrong way to do things. And if you want to get to the root causes of the problem, you have the painless testing, diagnostic testing. You would fill out a long form that's very comprehensive. Sometimes people don't like filling out forms, but we need to have the data to make the customizable treatment plan. And order the 4 tests and come in. If they specifically only want, say, Myers or Bioimmune, or they still can come, and we're never going to turn anybody away, and we're always kind to patients and meet them at their level and where they're at. But it is just a strong recommendation to see a provider in the bioregulatory realm here.
Mm-hmm. Yeah, and I think that speaks, you just referenced Dr. Drobot's BioBite on diagnostics. It is on our website. So if you're interested, perhaps you've not been with us for that particular BioBites, you might explore it. I know he goes over all the different tests available. As Joyce, you highlight, many of them are painless, and non-invasive, very easy to accomplish. They offer a lot of data. And I know, you speak to this point, the importance of getting to the root cause. I know that's one of the kind of foundational principles of biological medicine, and distinguishes it in many ways from conventional medicine. That is the point. So, and I'll just highlight your wisdom here, which is, yes, if you want to come in and you want to get a Myers drip or whatever it is, and know that you're going to get some vital nutrients into your body, great. But if you're interested, there's a lot more really to explore at the Biomed Center and with a lot of our biological practitioners in our network. But it's going to involve a little more work. And I think that's one of the great things. I'll speak from personal experience, right? You sit down with your patients, and Joyce, correct me if I'm wrong, but you really get a full health history. You ask a lot of questions you might never be asked or might have never been asked before about your health. And then that team of practitioners will work together to really try and figure out, how your particular systems have been configured given the variety of circumstances that we live in every day. So I think that there's a lot more to the approach, to the overall approach to health than just IV. But certainly this is a great tool in the toolbox.
Yes. Also with labs, when we're running labs, other than, IV nutrition, I won't get on a tangent, but we want to look at not only the normal value from the labs, but we want to look at optimal values. Mm-hmm. So there might be something within that normal value that we feel is optimal and functional in bioregulatory medicine. So it's very comprehensive. If there's an appointment made with one of the providers where it's a minimum of a first appointment, minimum is 1 hour.
Very good. All right, so again, I'll just highlight, Joyce provided the number. You can find them on our website. You can find the Biomed Center New England at their own website. Call the front desk and they'll be able to assist you. Additionally, Cara Berry is patient advocate at the center. She'll be great in directing you to the resources that you're looking for. We're coming towards the end of our time here, and I want to leave space if there are any other questions. Feel free to ask them, whether it's about IV or whether you'd like to know something about the Biomed Center or biological medicine. I'm sure Joyce would be happy to answer. I also want to highlight that on September 7th, we have our next BioBites all around supplementation. We'll be joined by Jamie Dufresne of the Biomed Center. Again, that's the first Tuesday in September on supplements. So if you've been trying to figure out, and maybe you've got, your shelves full of vitamin C and magnesium and whatever else you've got in there these days, God knows it might be a lot. Jamie can kind of help direct you as to how to adopt a safe supplementing routine. And again, it goes back to what Joyce was just saying, that you can do that all apart. You can take an IV as part of your personal regimen, but there's also the opportunity to incorporate that into your larger healthcare plan with a lot more data and expertise behind it. And that's something she'll speak to at that time as well. All right, well, I'm not seeing any additional questions. So I think on that note, we will wrap up for this afternoon. Joyce, thank you so much for giving us your time today. We appreciate it.
Thank you for having me.
Thank you, Joyce. That was great.
Yep,
Thank you so much.
Yeah,
Thank you, Joyce.
grateful to all those who joined us today as
you.
well.
Come
right.
see us. Thanks.
Everyone have a
Bye-bye.
great day. Bye now.
Thank you.
Take
Bye.
care.
Thanks again.